My name is Bruce Mutua from Crown Healthcare, Kenya. Last year we partnered with Hemex because at Crown we always continue trying to create reliable and quality and available services to the patients in this region. So now a month ago we had a meeting with a Rotary Club of Karen, and they were really struggling on how to do screening on genotyping for the sickle cell, because a lot of people in Kenya don't know their sickle cell type. And it's been encouraged even through the Ministry of Health that sickle cell is one of the burden under the non-communicable diseases. And as Crown, we want to partner with them so that we can be able to help people in the country to know their type, then they can be able to manage themselves better. Awareness is one of the first things that some of these organizations, like now the Rotary Club of Karen, now is trying to put it on. So I would want to put it like, it has to be, I saw from the government, the Ministry of Health manuscript that there's an awareness for non-communicable diseases. So, and I think sickle cell is supposed to be among them as compared to hypertension and diabetes. So the awareness is one of the reasons. Number two, I will attribute it to the cost of testing. So it has been, for you to do a sickle cell testing genotype, it's been very expensive in the country because you have very specialized, and then you see now a lot of people with the burden are the guys at the lower pyramid. So affording the test is it's been a challenge. But now with this product that we brought on board, now the testing is low, because we can talk about around $5 to $6 per testing, so which I think it can be affordable. And if we are able to partner with the Ministry of Health, the government, I think even the cost will come down, because now it will be directly, we deal with our mother company in the US, so that now it can be a special way of doing it, because we have the capacity to do the screening for the whole country. We roll out these machines of the last 4 months, and I can say within the country now, we can talk about 15 testing sites already, which both public and the private, and I can see a lot of inquiries through so many people. So currently I can see still the testing is too low. The real testing is too low, but with time and with this kind of awareness, correct partners, I can see by end of the year, or if the tempo goes the way it's going, maybe by mid next year, I would say we will be somewhere. We will talk about 1 million or 2 million in terms of testing. Definitely, that's it's going to need a lot of planning, and especially I would put the challenge straight to the Ministry of Health. I think the Ministry of Health need to roll it up. It must have a budget that can be able to do it. We need to have correct stakeholders like ourselves that we can sit down, we can discuss how do we partner. Because the Ministry of Health, and probably I would still say churches, and if we can also roll out all the Rotary, apart from the Karen now, is a good challenge. Maybe we can do Karengata, Rotary Club in Machakos, all over the country. I think it's also something that we can try to create awareness and increase some testing and save life. My final word, I can say we need to encourage testing. We need people to know their status. The way we started the initiative of people knowing their status in HIV, it will be a good thing also for people to know their status or the genotype for the sickle cell. It is going to be a good thing. Patient management, like in developed countries like France and India, where there's a lot of prevalence in the sickle cell, even these tests have been put in the algorithm of even when you're going for marriage. Your spouse has to be tested, and yourself you tested so before you marry, so you know your traits, because of the chances of having babies, chances of babies surviving, so that you can be able to minimize even before the courtship. So I would say it is good for each and every person to have their genotype for the sickle cell. Thank you.